So if we think of cancer as the hallmark disease of aging, the other disease that you see is cardiovascular disease. So all of us, if we're going to live long enough, we're either going to develop some form of a cancer or a cardiovascular disease, most likely. What we started to recognize about 20 years ago is that these cancer patients, once they survive their cancer treatment, have a much higher risk of developing aging-related conditions that's driven by the cancer treatment, the experience itself. It's just almost like an accelerated aging type picture that we saw, specifically in patients who were treated with very intensive therapies like bone marrow transplant. And so I was very interested in understanding the intersection between cardiovascular disease and cancer and where the two meet, because there was some amazing work that was being done in the cardiovascular world and amazing work that was being done in the cancer world. But the reality is that there wasn't much crosstalk, and there were patients with cancer or who were survivors of cancer who were developing cardiovascular issues like heart failure, heart attacks, strokes at a much higher rate than what you would expect for the general population. What's even worse was that once a cancer survivor they've survived their cancer, had developed cardiovascular issue like heart failure, stroke, etc., their survival rates from that condition was much worse than their peers. So it made me think, well, wait a minute, what's the point of curing these individuals when they're going to succumb to all the complications of therapy, etc.? And that really drove my initial work in the cardio-oncology world. And now cardio-oncology has become a term, and it's in fact become a discipline. There's a journal and there's meetings around that particular field. So it's really blossomed in part because of the broader oncology and cardiology community's recognition